Hi, I'm Dr. Pouts. I head the Persephone Healing Arts Center in North Jacksonville Beach, Florida. I'm board certified in internal and integrative medicine. I hold several other certifications. I earned an herbal fellowship. I earned an integrative neurology fellowship. I am also a Walsh practitioner, and I'm also a certified eurythmist, a movement training that we teach in the Waldorf schools. It's an accepted stage performance thing and is also applied therapeutically. I said I would follow up with another case report or example, maybe would be better said, of how watercoloring can be used in therapeutic interventions in medicine. This is done in places where we have anthroposophic hospitals or floors or interventions, outpatient too. There are people that are trained in this philosophy. Anthroposophic medicine is recognized by the World Health Organization, WHO, as of 2023 as an accepted interventional discipline, similar to yoga, acupuncture, Chinese herbal medicine, and many other disciplines. So the last time we had a patient that had ulcerative colitis, okay? And it was a watery, fluffy thing, and she made great improvements under pencil drawing, which is very formed. She had a very unformed process in the lower colon, and the pencil drawing helped her to structure her life forces that were not structured in this area. And it's not an intellectual thing. No, nobody wants to be sick. Nobody would be sick or have health issues or challenges or opportunities for growth if we all did it with our intellect. So it's much, much deeper than that. So we had that example today. I said I would talk about watercoloring. So something very watery, which can be indicated in places where things have gotten too rigid, too hard, too isolated. So you give the patient the task of coloring yellow and blue. And so then a patient, and I say later what kind of conditions sometimes lead to this. And again, we're all unique, all different. We have all different predispositions. So one shoe does not fit all. So anybody who just has that illness wouldn't always paint the same thing. They may be very different. But one scenario is that you give the patient the task to interact and have blue and yellow talk with each other and interact on the paper, obviously watercoloring paper. So then someone may paint yellow globe like a sun, very dense, everything the same color, no fluctuations in there, and blue around it, and sometimes the blue can be very compact and also not breathing and whatever. So this can be a situation, again, it's individualized. Don't say this is going to be the case with everybody, it's not. But often when you have a cancer and a solid tumor, the interaction and the breathing with the communicating other tissue around is not there, or the cancer couldn't form in the first place. So basically they're painting their cancer, an isolated round thing on the piece of paper. Now, when you therapeutically intervene, you will help the patient, client, to have yellow and blue interact, so it's not so rigid. You will have shades like you have shades in the sky with the clouds. The sun is shining through there depending on the thickness of the cloud and the water crystallization and humidity. The shades will be very different. So that's an interactive sky, okay? So you will use the watercoloring as a medium to help somebody do that. There's another case from my practice where I was working with somebody very, very dear for many months, 2 years actually, and he had multiple cancers, like 6 cancers when he presented first, and the last one was metastasized. and we did additional integrative therapies. So I did therapeutic eurythmy with this patient, which I'm trained in eurythmy. And we did the 5-star, which is a very typical form that we do in eurythmy sessions sometimes. And we would go to the right foot, to the left hand, to the right hand, to the left foot, and back into the head on the ground, okay? So we did this once a week, once every other week. Was a little bit of breathing thing how we met and did this, because we did other things too. And after the third 5-star line, this patient would be like this, totally to the side, totally to the right. He was unable to keep his focus front line like we would have, what the exercise was. So he had a huge tumor burden on his right side, abdomen too, huge tumor burden. So he basically turned with this emphasis towards the tumor burden every time for 6 months, every time we practiced, and he practiced some at home too, to the right side. And although he was so smart and intellectual, trained and high IQ and everything, he was unable to manage this. So the therapeutic intervention is that you help structure these things. So that's another example of art therapy intervention, movement therapy intervention in this thing. Thank you for listening. Again, I'm Dr. Pouts. Our phone number is 904-246-3583, and our website is www.drpautz.com, DRPAUTZ. Thank you for listening, and I hope you got some ideas out of doing this. Thank you. Bye-bye.